Hello everyone, we have our new topic in MAPEH Health, which is all about identify agencies responsible for non-communicable disease prevention and control. This will be the fourth quarter topic and week number 8. This topic is ML-based. For the most essential learning competencies, it seeks to achieve the learning competency is to identify agency responsible for non-communicable disease prevention and control. And we will focus our learning objectives with the following. The first one is to describe the agencies responsible for non-communicable disease prevention and control. And the second one is to identify the responsibility of these agencies in the prevention and control of non-communicable diseases. Are not careful with the food that we eat, which in the later part, if not early part of our life, will result to disease. We must remember that there are lifestyle diseases that we acquire from eating too much fatty foods, drinking alcohol, smoking tobacco, and even being inactive. Lucky enough, there are agencies responsible for non-communicable diseases prevention and control. In the Philippines, the Department of Health have accredited the following hospitals to cater to the needs of the Filipino people with non-communicable diseases. The following are the Philippine Heart Center, National Kidney and Transplant Institute, the Lung Center of the Philippines, and the Rural Health Units. The Philippine Heart Center, this hospital is the leader in supporting the highest standards of cardiovascular care, self-reliant institution responsive to the health needs of Filipino by 2022. The Philippine Heart Center caters to people with heart problems. In Davao City, Southern Philippines Medical Center, which is the biggest hospital in the Philippines, was the first regional center supported by the Philippine Heart Center. Another hospital that caters the Filipino with non-communicable diseases is the National Kidney and Transplant Institute. The National Kidney and Transplant Institute is a government-owned and controlled corporate tertiary specialty center attached to the Department of Health. Its mandates is to specialize in the prevention, diagnosis, rehabilitation, and treatment of kidney and allied diseases through dialysis and transplantation. Another hospitals that caters the Filipino with non-communicable diseases is the rural health units. The rural health units are designated by the Department of Health to disseminate information to the community on how non-communicable diseases can be avoided. The doctors in the rural health units are also capable of giving diagnosis on any patient coming for a checkup, and they can refer the patient to any hospitals that can cater to his needs. Under the rural health units are the barangay health centers who will give the initial findings and refer to the patient to the nearest hospital that can give the patient the immediate medication needed. These are the things you need to remember in this topic. The agencies responsible for the non-communicable diseases prevention and control. So there are agencies in the Philippines that are responsible for the non-communicable diseases prevention and control. They are the Philippine Heart Center, the National Kidney and Transplant Institute, the Lung Center of the Philippines, and the Rural Health Units. These agencies are responsible in the diseases for the heart, kidney, lungs, and other non-communicable diseases.